Thanks everybody for joining us. My name is Rachel Holtzman. I'm a white woman with brown hair who's wearing a blazer and a purple shirt. I'm a policy consultant with the New York Legal Assistance Group, and I'm joined here by Rebecca Wallach, who is the director of the Evelyn Legal Resources Program. Today, we're going to talk about MECM, the Medicaid Eligibility and Client Management System. And we're going to give a reintroduction for those of you who already know about MECM, or an introduction for those of you who've never heard about it before. This is the new website for some Medicaid and MSP applications and renewals. And just a little reminder, this is the first of a two-part summer training series on MECM. First, just a few housekeeping rules. Everyone is on mute. That way we can make sure this runs smoothly. You can post any questions that you have in the Q&A. If you can't find it on your screen, look towards the bottom of your Zoom. There may be a little circle with 3 dots that says more. If you click on that, you should hopefully be able to see a Q&A option. We will send out a copy of the slides afterwards and a recording of the presentation to everybody who registered. So if for any reason you need to leave early, don't worry, we've got you covered. And you are very, very welcome to share these materials with others. Our hope is just to educate as many people as possible. So please feel free to share. So just a bit about NILAG. NILAG uses the power of the law to help New Yorkers experiencing poverty or in crisis to combat economic, racial, and social injustice. You can read more about us on our website. And now about the Evelyn Legal Resources Program. We call our unit EFLRP, and I'm sure that many of you have heard that term before. We focus on fighting for older adults and people with disabilities to ensure they have access to healthcare and home care services that they need in order to age safely in their home and in their communities. So in EFLRP, we do counseling of clients. We do trainings like the one that we're giving today. We represent clients in denials and reductions of Medicaid, the Medicare Savings Program, and Medicaid home care. And we assist clients with accessing Medicaid home care through managed long-term care plans. In EFLRP, we also run the New York Health Access website, which I hope many of you have heard of before. If you haven't, I really encourage you to write this website down and make sure to check on it and click on it after the webinar is over. This is our public-facing website that we use to post policy updates, consumer-facing materials like Know Your Rights materials, and it really just has expansive resources on coverage criteria, eligibility, and more. The intended audience for this is the public. It's social workers, advocates, family members, Medicaid self-advocates, Medicaid recipients, and we hope that you'll check it out. If you are not already subscribed to our newsletter, I highly encourage you to do so. I promise we will not spam your inbox. We send out one newsletter roughly a month, and it mostly includes important Medicaid updates that we want you to know about, changes that are happening in New York State or perhaps on a federal level. And we also include information for our trainings, registration links, dates and times. So if you aren't signed up, we highly encourage you to sign up. And as I mentioned before, today is the first of a two-part summer training series on MECM. The second one is going to take place on Thursday, July 9th, and it's going to take place at 11:30 in the morning. Rebecca will post the registration link into the chat. Perfect. And it's going to be a troubleshooting session. So whereas today we're really giving an introduction into MECM or a reintroduction into MECM, our session on July 9th is really going to talk through how to issue spot and how to hopefully troubleshoot issues when they arise for your clients. We're going to talk through questions like, how do you know which system the client's case is in? And we'll actually talk a little bit about that as well today. If your client's case is on MECM, but they need home care, what do you do? If your client's Medicaid case is up for renewal and there's an issue, what do you do? So we'll talk through that and we'll share the most up-to-date information that we know about how to problem solve, recognizing that this is a rapidly evolving new area of Medicaid policy in the state. And so we'll give as much up-to-date information as we have. Okay, so an agenda for today. First, I'm going to give a Medicaid background. just to make sure we all are on the same page about some key Medicaid terms. Then I'm going to give an introduction to MECM. We're going to talk through what Medicaid eligibility systems looked like before and after MECM. We're going to give some tips for finding where your client's case lives. So how can you figure out where it is, especially now that we have this new eligibility system. We're going to give some tips for appeals for cases that are in MECM. We're going to give some information on where you can go for help. And finally, at the very end, we will have a time for Q&A. Again, just a reminder, if you have questions during the webinar, please feel free to put them into the Q&A feature on Zoom, which you can find at the bottom of your screen. Okay, so let's start with a Medicaid background. So there are two different types of eligibility categories for Medicaid. One is called MAGI, Modified Adjusted Gross Income. One is called non-MAGI. So what's the difference? Okay, here on the left, we have MAGI Medicaid. This is also called expansion Medicaid. Some people call it Obamacare or ACA Medicaid. Generally, you think about young families, people under 65 who do not have Medicare. On the right, you see non-MAGI Medicaid. And as you know, in Medicaid, we love to have many different ways to say all of our terms. So you may hear this referred to in three different ways. Sometimes people call it SSI related Medicaid. Sometimes you hear it called ABD or Aged, Blind, Disabled Medicaid. And sometimes the letters are a little reversed and it'll be DAB or DAB. It's the same words, disabled, aged, blind, Medicaid. And generally what we're thinking about is older adults, people who are 65 or older, or people who are under 65, but they have Medicare because they have a disability. I'm not going to go over this slide in too much detail, but I just want to briefly give some examples of who is MAGI and who's non-MAGI. Okay, so let's start by looking on the left. So a few examples of people who are in the MAGI eligibility category in New York State include pregnant people, also presumptive eligibility for pregnant people, infants and children who are under age 19, the new adult group, this is also sometimes called the expansion group, childless adults, or some parent and caretaker relatives. Meanwhile, on the right, we have our non-MAGI eligibility group, and this includes, for example, SSI recipients, also people who have the Medicare Savings Program, people who are enrolled in AHIP, the AIDS Health Insurance Program, or people who are in the Medicaid buy-in for working people with disabilities, which is also called MMP-WIPT. Okay, so how do you qualify for each of these? So you'll see, you can still see the heading across the top. So MAGI on the left, non-MAGI on the right. So on the left for MAGI, the income limit for MAGI is 138% at the federal poverty level. And the income limit for non-MAGI is the same. So what's the big difference? One of the big differences is how you calculate that income. So for MAGI eligibility groups, you calculate using tax rules. Whereas for non-MAGI, you use something called SSI related rules. These are different from tax rules. EFLRP always puts out a Excel sheet that helps you calculate someone's income using the non-MAGI SSI related rules. You can find that on our New York Health Access website. Another big difference is the asset limit. For MAGI eligibility, there is no asset limit. So the resources that you have, the savings and other resources, that does not count against you. There is no limit. But for non-MAGI, there is an asset limit. So that's a big difference also between the two. Okay. So I know you all are here because of MECM, so thanks for your patience as we just went over some of that background. So now we're going to talk about why we're all here about MECM. But before we do that, Rebecca's going to launch a poll. And I want to know, have you heard of MECM before today? And so you just take a few seconds and answer this poll. And when you're done, you can click submit. And then we'll launch the results in just a moment. Great. So thanks everybody who responded. So I see it looks like 62% of people have heard of it and 38% have not. I want to say, for those of you who have not heard of it, don't feel bad. It's very, very new in New York State. It just began in the fall. And so many people have not heard of it. It is really new. And so you're doing exactly the right thing by joining us today and learning more about it. So thanks for those who have heard about it and are getting a reintroduction, and also the 38% who have not and are learning about it for the first time today. Thanks for joining us. Okay, so what is MECM? What is the Medicaid Eligibility and Client Management System? It is a back-end eligibility system. And what does this mean? So an eligibility system, and you'll hear me use that term today, it's the system that processes applications and renewals to determine eligibility. So you can think about this as a door that somebody has to go through in order to get and keep their Medicaid. MECM handles eligibility, again, via applications and renewals. For right now, just for non-MAGI Medicaid, remember that's the group I was explaining before, the disabled adult blind, for some people who are non-MAGI Medicaid, and for the Medicare Savings Program. But in the future, additional groups beyond the two I just mentioned, beyond non-MAGI Medicaid and beyond MSP, additional groups will be included on MECM. MECM just handles eligibility. This means MECM does not handle healthcare services. So for example, MECM is not involved in approving someone's physical therapy or reducing someone's home care hours. You can sort of think of it as a lever. MECM is about a yes or no switch. Do you qualify for Medicaid or do you not? Do you qualify for the Medicare Savings Program or do you not? It's not about the wide spectrum of services, all the different healthcare services that exist and how much you qualify for. It's just the sort of yes-no lever. And MECM is a multi-year project. So it actually started behind the scenes in 2023, even though it didn't really launch until 2025. And it's planned until 2032. And the plan is to migrate all cases that are at the local Department of Social Services. That's the acronym LDSS. In New York City, we call it HRA. To migrate all cases from the LDSS or HRA, which uses an eligibility system called WMS. I'll explain that in a bit. To migrate all of those cases to NISO, which is using the the MECM system. And if thinking about those eligibility systems is a little confusing, that's okay. I'm going to explain more in a bit. Okay, so this is a really important slide. And again, everybody's going to get a copy of this webinar. And if you do nothing else, I might recommend that you take if you print out one slide from this webinar and post it somewhere in your cubicle or post it at home by your work computer, I'd recommend this one. So this explains where are non-MAGI cases now. And you'll see there's a little asterisk next to the word non-MAGI because most of these cases are considered non-MAGI, not all of them. Some are actually MAGI, but just for the sake of simplicity, we're going to talk about them as non-MAGI. Okay, so on the left at the LDSS, remember this is the local Department of Social Services, or HRA is what we call it in New York City. Right now, any person who has non-MAGI Medicaid who has at least one of the things on the left that you see on your slide, their case has to be and should be at the local Department of Social Services or HRA. So if they have at least one of the following: chronic care budgeting or nursing home budgeting, a pooled income trust or a resource trust, a surplus, sometimes you'll also hear this called a spend down or excess income, spousal impoverishment budgeting, DAC, which is the Social Security Administration's Disabled Adult Child Program, MIMBY-WIPT, which is the Medicaid buy-in for working people with disabilities, home care through an MLTC plan, or home care for somebody who has straight Medicaid and they get their home care through the LDSS or through HRA, or anyone who is in one of the four waivers that we have, home and community-based services waivers. So this is the OPWDD waiver, the traumatic brain injury waiver, the nursing home transition and diversion waiver, or the children's waiver. If you know somebody who has at least one of those things I just said, their case should be at the LDSS. Their Medicaid case should be at the LDSS or at HRA. Also, if you know someone whose Medicaid case is at the LDSS or HRA, their MSP case should also be at the LDSS or HRA. Okay, and how about on MECM? Which cases can be on MECM? It's really the non-Magi Medicaid cases that don't have any of those things I just said on the left. But it's okay if they do have any of the bullet points on the right. They don't have to, but it's okay if they do. Their case can still be an MECM. So it's okay if they have special refusal budgeting, but they don't have to have that. And it's also okay if they have home care through a mainstream plan. And an example of somebody who might have home care through a mainstream plan is somebody who is 65 years or older and undocumented. Undocumented 65 plus population receives home care through mainstream plans. So, and also an MSP case for anyone whose Medicaid is in MECM or anyone who doesn't have Medicaid yet, their MSP case would also be in MECM. Okay, I know that was a lot of information, but we're going to try to test you on it. But don't worry, I'm not writing down who, I have no idea who answers which way. Okay, so Rebecca's going to launch our next question. Poll question number 2. Lucia is a 72-year-old. She deposits $500 per month into a pooled income trust to qualify for Medicaid and the Medicare Savings Program QIMBY benefit. Which eligibility system should her case live in? The first answer is WMS. So you can think this is the system at the local departments of social services or HRA. Or should her case be at NISO, which is also sometimes called the Health Benefits Exchange or the Marketplace? Or should her case be in this new system called MECM? And in case it's helpful, just as a reminder, the slide before, all of the bullet points on the left, those were the cases that should be at the local departments of social services or HRA. And the bullet points on the right are the cases that can be in MECM. So take another moment to think about your answer. Great. Okay. So I see 80% said that her case should be at WMS, and that is the correct answer. And this is because she has a pooled income trust. And anybody with any sort of trust, their case needs to be at the local Department of Social Services. And so her case should be in the local Department of Social Services. Okay, so I know that was sort of tricky. And so what I'm going to do is I'm going to give everybody a chance to look at that slide again to see what's on the left and what's on the right. And I'm giving you a chance because we're going to ask another question. So familiarize again yourself with whose cases should be at the local Department of Social Services or HRA. Those are the cases that are on the left, that have anything on the left. And whose cases should be in MECM, and that's the bullet points on the right. Okay, I think you're ready. Rebecca's going to launch poll question number 3. Maya is an 81-year-old. She's enrolled in an MLTC plan, and she receives 20 hours per week of home care. Which eligibility system should her case live in? WMS, which is the system that exists at the local Department of Social Services, those were the bullet points on the left, on the slide before. NISO, which is the Marketplace, or MECM, the new eligibility system, and that was the bullet points on the right. So take another moment to think about your answer, and then Rebecca can launch the results. Great. It looks like 70% of people gave the correct answer, which is that her case should be at the local departments of social services or HRA. And this is because she is in an MLTC plan and she receives home care. So anybody who is in an MLTC plan and who receives home care, their case is supposed to be at the local Department of Social Services or HRA. Okay, good job, everybody. Thanks for participating. Now we're going to move forward. Okay, so one additional caveat to thinking about these non-Magi Medicaid cases that are in MECM. So these cases include new cases. So somebody who's never had Medicaid before and they're applying for Medicaid and they meet that criteria on the right-hand side of this screen. But also there are some people who already received Medicaid, let's say for years. And let's say that their case was on NISO, or let's say that their case was on at WMS, which is the eligibility system at the local departments of social services or HRA. But they meet the criteria on the right for who can be in MECM. These cases are actually being transferred or moved by the state into MECM in monthly batches. There's no opt-in or opt-out process. There's no permission form. It's just happening automatically behind the scenes. The renewal date for these people is supposed to stay the same in MECM as it would have been in NISO or at the local departments of social services or HRA. And there should be some notices, and we'll really dive into the notices that transferred cases receive in our second webinar. But just as a reminder, it's not just new people applying for Medicaid for the very first time on MECM. There's also some people who have had Medicaid for 5, 10, 15, 30 years, and they've been on NISO or they've been on WMS at the local Department of Social Services or HRA, and their cases are being moved by the state. There is no opt-in or opt-out. The cases are being moved in monthly batches onto MECM. Okay, so that brings us to our next poll question. This one's a little bit of a tricky one. It's okay if you don't know the answer, but I think you'll get it. Poll question number 4. John is a 71-year-old. He has had Medicaid for 10 years, so he's had Medicaid since he was 61. He turned 65 in 2020 during the pandemic. He has never received nor needed home care. Which eligibility system does his case currently live in? And where will it be moved to by the state? So that's the little hint. Where will it be moved? I was just talking about cases moving. So I'll read it one more time because I know this one's a little tricky. John is 71. He has had Medicaid for 10 years since he was 61. He turned 65 in 2020 during the pandemic. He has never received or needed home care. Which door or eligibility system does his case currently live in? And where will it be moved? So take another minute to put down your answer. And then Rebecca can share the results. Okay, so this was very tricky, but 69% of people got the correct answer, which is that his case is in NISO, but it will be moved on to MECM. And I'm very impressed because this was very tricky. And if you made sort of an educated guess, that's okay too. So let me explain this. His case was in NISO because of certain protections from the COVID public health emergency. People who had Magi Medicaid, people who were under 65 like John, he was 61. People who had Magi Medicaid on NISO during the pandemic, their cases stayed on NISO even if they became non-Magi, so even if they turned 65. And so John did turn 65 during the COVID protections during post-2020, but his case stayed on NISO. But now, because he doesn't need home care, he doesn't have any of those bullet points that we saw on the left before, now he is eligible for MECM. And so the state is going to move his case on to MECM. And again, he does not have the opportunity to opt in or opt out. This is just happening automatically. Once again, great job, everybody. Okay, so whose cases can be an MECM in sort of now and in the future? So I guess really, and actually let's sort of focusing on in the future. The short answer is everybody who's not on NISO, they are all going to be on MECM in the future. And so the longer answer is that by 2032, the State Department of Health, DOH, plans to bring all populations that are currently at the LDSS HRA, all of them, all Medicaid cases, into MECM. This is happening in what's called waves. You can sort of think of it as different stages. So wave one or stage one, this happened in September. Those were the cases that met the criteria that you saw on the right hand of that important slide. Those cases were brought into MECM. Wave two was starting in April 2026. The Medicare Savings Program cases that have been created using federal data from the low income subsidy, which is also called extra help, those cases started being in MECM. Sometime, and actually it was originally going to be in May. Now the thought is it might be in June or July. So May was sort of the initial estimate, but that date has changed. Presumptive eligibility for pregnant individuals benefits will launch in MECM. That is a MAGI benefit. That is not a non-MAGI benefit. So that's exactly why I was saying that although right now it's some non-MAGI Medicaid people and some MSP cases, there will be MAGI cases as well that are being brought in. And the very first group of MAGI cases being brought in is presumptive eligibility for pregnant individuals. And then in the future, there will be additional waves. The state has not yet announced the details of which groups are being moved over when, but at some point that information will be shared with the public. Also, by the end of this year, the end of 2026, all of the 150,000 non-MAGI cases on NISO, this is like the example John we just gave, who was 61 when he got Medicaid on NISO, but he turned 65 during the COVID public health emergency. So he became non-MAGI, but his case stayed on NISO as a protection. All of the cases like John, there's 150,000 of them roughly. By the end of 2026, all of them will be brought into MECM. And just as I said, these cases became dual eligibles during the pandemic, but they stayed on NISO because of public health emergency protections. Okay, so where does MECM live? So it's integrated into NISO, which means that some clients may not even realize that they're in MECM. So if you think about John as an example, he's been going onto the NISO website for his health insurance, or he's used to getting letters in the mail from NISO. All the MECM stuff will be branded as NISO. He's still going to go to the NISO website. He's still going to get letters that look like NISO. So people like John may not even realize that they're actually in the new MECM system. Of course, if your case has been at the local Department of Social Services historically, and all of a sudden you start getting letters from NISO, then you probably will realize, or you may realize that your case has changed. So there's two different ways, and I'm going to show two different images on the right about how you can get to MECM. So the first is when you go to the NISO website, you can click here, it's circled in red, that says enrollment available for individuals who are age 65 or older, have a disability, or have Medicare. And there's a little yellow button that says apply today. That's one way to get into the MECM system for people who are applying for Medicaid or the Medicare Savings Program in MECM. But there's a second way, and it's on this top right-hand part of the screen. And I'm sorry that it's a little small, but if you go onto the NISO website, you can see it. When you hover your mouse over the yellow button that says sign in, there's a drop-down menu that has 5 options. The second option says individuals 65 plus or disabled or blind. If you click that, it'll bring you to a page where you can either log in if you already have a login, or you can register an account. Now, where can you learn how to actually navigate NISO? NISO has a YouTube page with a lot of different public-facing videos, and I recommend that if you're not familiar with NISO or if you have some questions, just scroll through the YouTube page and check them out. They're really short. They're, a minute and a half, so you don't have to sit and keep your attention like you're doing a great job for this webinar. They're really short, and they talk through different questions like how to begin an application, signing into your account with an invitation code. And there's additional ones that I've shown here, like ways to submit documents and understanding your document submissions. Now, the caveat that I'll say is that none of these videos are created specifically for MECM. So you're not going to hear the phrase MECM. You're not going to hear Medicaid eligibility and client management system. You're not going to hear non-Magi Medicaid. You're not going to hear Medicare Savings Program in these videos. Hopefully in the future, maybe there'll be some videos that are specific to MECM. But at this point, these are just general videos for anybody who's on NISO. So if you're watching any of these videos and they mention something that does not feel relevant to you, that's probably why. It was because these videos were built for people who either have Magi Medicaid or people who are buying commercial plans, also called qualified health plans, or people who are enrolled into the essential plan, because those cases are also on NISO. But I still recommend this as a place to go just to familiarize yourself with how to navigate the website. Okay, so why did the state make this change? One reason is because with this new website, users can self-attest. So what that means is some information that is asked on applications or renewals, the user's going to be able to just say what the answer is without having to provide documentation. And the way this works is the system online is going to talk to other data systems at the federal level and state level to check. So instead of asking you to upload the document to prove it, this computer system is going to ping these other data sources and try to make sure that what you say is correct without asking you to provide the proof. Also, there's a nudge engine. So users are going to be prompted to provide more information when the system can't verify. So if you say something's true about your income, the system tries to ping a state or federal data source, can't get the answer, it'll nudge you and it'll say, please provide XYZ document. Another benefit is that MECM is giving quicker results. So these are quicker results at application. So quicker eligibility determinations. Many are on the same day. And actually 93% of new applications in MECM have had real-time eligibility determinations. So you click submit and within like a few seconds or minutes, you get your answer. This is very different from, the local departments of social services and HRA where there can be a real backlog of weeks or even months. Also quicker results at renewal. So there's going to be something called administrative renewals. It's also sometimes called ex parte renewals. These are completed by the system without you having to do anything. The Medicaid enrollee does not have to do any paperwork or even lift a finger. So those of you in New York City who are really familiar with getting those big renewal packets in the mail, you can say goodbye to those renewal packets. If the system can get all the data it needs, it'll just renew you automatically and you don't have to do a thing. So that's great. Also, MECM is going to lead to higher MSP enrollment. Nationwide, only 60% of people eligible for the Medicare Savings Program are actually enrolled, and it's a huge financial benefit to people who qualify. And also, the legacy system called WMS is outdated. So let's talk a little bit more about WMS. I know I've used that term throughout these slides, so let's dive into these systems. So before MECM, what were the two Medicaid eligibility systems in New York State? And again, I'm using the word eligibility. I am not talking about services. I'm talking about this yes, no lever. Are you eligible or are you not? Okay, so on the left, we have NISO. This is the newer system that was developed in the 2010s along with the Affordable Care Act. And it's also called the State Marketplace or the Health Benefit Exchange. This is the system that does Magi Medicaid. It also does qualified health plans and the essential plan. And it's statewide and online. On the right, we have the eligibility system called the Welfare Management System, or WMS. And I have a picture of an old computer just to show you that this is our legacy, meaning it's sort of our older system. It's from the 1970s, so it's 50 years old. And this is what is still used to this day by the local departments of social services, or HRA. So it's an older system. And that's why it's clunky, just because it's older. So MECM is now a third eligibility system in New York. And how does that work? So this is the doors. Again, we really like thinking about this as doors. So on the left, you have the door of NISO. This is how people with MAGI, Medicaid, and again, qualified health plan and essential plan, this is how they move into and get and keep their health insurance. And on the right, you see this red door. You also see that photo of the old computer. That's the old legacy WMS system. That's historically been the eligibility system for that non-MAGI Medicaid people use. That was the door they moved through in order to get and keep their Medicaid. Now we have a third door, this green door in the middle. And you'll see that we used a photo of a smartphone just to sort of show you this is like the newest system of the three. And this is the system that for now, some non-MAGI Medicaid and MSP eligible people are going to use. They're going to go through this door to get and keep their Medicaid. So how many enrollees are in each system? So between NISO and MECM, there are currently 4.1 million people. And meanwhile, in the legacy system in WMS, there's currently 2.6 million people. And this arrow is just a reminder that all 2.6 million, sometime between now and 2032, the plan is for all 2.6 million Medicaid cases in WMS to be moved into MECM, if that's the appropriate place for them, or onto NISO. The plan is that there will be no Medicaid cases at the local departments of social services, or WMS, or HRA rather. Okay, so now we're going to do another series of polls, and this is a fun game. I think it's fun. I hope you do too. We're going to talk about some tips for figuring out where your client's case lives. So we have a little detective magnifying glass there, and you may need it because really the main tip is you're going to look at the notices. And some of these notices, the images are a little small on my slides. So again, I apologize for that, but you can take a look at the slides afterwards because we will send out a copy of the slides and a copy of the recording to everybody who registered. Okay, so this is just a reminder of the three doors. We have NISO on the left, MECM in the middle, WMS on the right. These are the three doors that you have to move through to get or keep your Medicaid in New York State. All right, this is our first notice. Again, I understand that's a little small, so you can imagine having your magnifying glass, or after this, you can open up the slides on your computer and zoom in. But you see here on the top right, it says Notice of Decision on your medical assistance. Top left, Medical Assistance Program, Managed Long-Term Care. You see a lot of boxes, sort of looks like typewriter font, pretty text heavy. A lot of boxes here. There's, it tells you, the unit. There's a variety of pieces of information here. So Rebecca's now going to launch a poll. And the poll question is, which eligibility system does this case belong to? Does this case belong in the door of WMS, which is the eligibility system that exists at the local Department of Social Services, or HRA? Does this notice, this case belong to NISO, the door for people on the exchange, or does this notice belong to the door of MECM? So take a second and think which door this belongs to. And then Rebecca will go ahead and launch the results. Okay, very good. 84% of you got the correct answer, which is that this notice belongs in the door of WMS. You can see here we sort of have an example, we circle the door just to show you this case belongs in WMS. And it's because it's a notice from HRA. So if you see these notices, again, they sort of look like typewriter font. They're pretty text heavy, a lot of black boxes. These are notices that come from HRA. So they were generated by the eligibility system at HRA, which is called WMS. Okay, next question. This notice, which door does it exist in? So Rebecca's going to launch in a second, but first I'm going to just sort of walk you through the notice. Okay, so the top right, we see New York City HRA. Top left, notice of acceptance of your medical assistance application and recertification. And then we see again, it's still pretty text heavy, but not quite as boxy. The text is not typewriter font, and it gives a budget. So which door does this eligibility system belong in? So you'll see on the poll, the first option is WMS, the door that's at the local departments of social services or HRA. There's NISO, and there's MECM. Okay, Rebecca will go ahead and launch the results. Very good. 69% of you said WMS, which is the correct answer. And I know that it can be a little bit confusing because the last notice and this notice look a little different, but both of them are are examples of different notices that you may get from a local Department of Social Services or from HRA. And so both of these notices are generated by the eligibility system that exists at HRA. So it's the eligibility system. Okay, great. I'm realizing that this was sort of in a different order, so sorry about that. Okay. So great. That was the WMS notice. Okay, so we have two more for you. So it's going to be poll questions 7 and 8. So this is for poll question number 7. Take a look at this and try to think. Is this a notice that comes from WMS? Is this a notice that comes from NISO, the New York State of Health? Or is this a notice that comes from MECM? Rebecca will launch the poll. Okay, great. And I'm realizing that, sorry about this. I know it says poll question number 7, and this is poll question number 6, but this is still correct. Okay, so which door does this case belong to? Is this for WMS? Is this for NISO? Or is this for MECM? Which door does this case belong to? Which eligibility system? So take another minute to think about your answer. And then Rebecca will go ahead and launch. Perfect. Very good. So 88% of you got this correct and said that this is a notice that comes from NISO. And let me show you. So the way that you can tell, look at these red arrows I have. So each NISO case number begins with the letters AC. You see it says account ID AC, account number AC. And each marketplace ID begins with the letters HX. So again, I apologize, it's sort of small. You can zoom in when you get a copy of the slides. But down here on the bottom left, it says marketplace ID HX. And down here on the bottom right of the screen, it says marketplace ID HX. So if you get a notice that has NISO, New York State of Health, across the top, and you look and you see AC and HX, this is a NISO notice. This was generated from the NISO eligibility system. So once again, it was NISO. How about this one? Okay, so this one, again, has New York State of Health across the top, but it has something a little different. So I'm going to give you just another second to take a look. And then I'm going to have ask Rebecca to please launch the poll. Great. So which door does this one belong to? That notice, was that a WMS notice from the local departments of social services or HRA? Was it a NISO notice or was it an MECM notice? Take another minute to think about your answer. And then we'll go ahead and launch the results. Okay, very good. Maybe you guys heard me sort of give you a nudge, say something was a little different, or maybe you just knew. But 76% of you got this right, that this is from MECM. And so, and the way that you could tell that this is from MECM is because For MECM notices, even though it says New York State of Health across the top, it's branded as NISO. The case numbers begin with MC, M for Mary. So you see case number MC, not AC, like the ones that NISO did. And each member ID begins with a PX, P for Peter. So you see here member ID PX and member ID PX. That is different from the NISO notices. The NISO notices, these numbers started with AC, and these numbers started with HX. And so it's a very small difference. And we know, again, it requires your magnifying glass, but it's important because if you're working with a family member, a friend, or a client, and they get a notice from NISO and they're sort of confused where their case is, this is a good way for you to tell. So this is an MECM notice. But don't forget. So this cases that are moved from the local Department of Social Services into MECM, the state calls these scoop and dumped. They're scooped from the local Department of Social Services and they're dumped into MECM. They do what's called a tiptoe month in NISO. And so that's why we have an image of the tiptoe. So during the tiptoe month, the consumer receives notices with the NISO identifiers, and only after that month is done will they be fully transitioned into MECM, where they will receive MECM identifiers. If this is a little confusing, totally understandable. Please join us for our second webinar because we will dive into those notices and show you all the notices that somebody's going to get and really talk you through that system of a case being at the LDSS or HRA, being scooped up, doing a temporary tiptoe month in NISO, and then eventually being permanently dumped into MECM. So again, please do join us for that second webinar. All right. Now we're going to talk briefly about MECM appeals. So the most important thing for appeals is knowing where to go. And it's sort of confusing right now. Historically, eligibility hearings for people who had NISO cases, the hearing was heard by NISO, and the service-related hearings about their home care, physical therapy, those hearings were heard by OTDA, the Office of Temporary and Disability Assistance. And historically, the cases at the LDSS or HRA, eligibility systems were heard by OTDA. Eligibility hearings were heard by OTDA, and service hearings were also heard by OTDA. Now, people who are in MECM, these are cases that for the most part used to be at the LDSS or HRA, and they're used to having their eligibility hearings by OTDA. Their eligibility hearings about whether they do or do not qualify for Medicaid are now going to be heard by the NISO appeals unit. But please keep in mind, every single service hearing in New York State, if you have Medicaid, every single hearing about what type of services you qualify for, how many home care hours, if you do or you don't get physical therapy, everything related to a healthcare service, all of those appeals will still be with OTDA no matter which door your case is in. Okay, so please keep that in mind. But we're just talking about eligibility. Do you or do you not qualify for Medicaid? Do you or do you not qualify for the Medicare Savings Program? That is where it depends upon which door your case is in. And for MECM, those hearings are with the NISO appeals unit. Rebecca is going to put this link in the chat. We want to make sure everybody knows about the NISO FAQ page on appeals. It was updated in January 2026 to reflect MECM relevant information. And this is a great go-to one-stop shop for learning all sorts of important things about NISO appeals with the NISO appeals unit. So again, MECM appeals are with NISO. So you can ask about how you submit evidence and how you can access NISO's evidence. You can ask about, what happens during the hearing and what happens if you need to reschedule. So we highly recommend that you check out the page, and Rebecca put it in the chat. Next page we want you to check out, which Rebecca will also put into the chat, is the NISO forms page. And the ones that I want you to really focus on are these two that we have the yellow stars for. Form DOH 5231 is the appeal request. So if you want to request an appeal, you can call the call center, but we recommend that you fill out this form and you fax it, and I'll show that in a second. And the second yellow star is for this DOH 5232. That's if you want to appoint a representative who does not work at a law firm. If you're appointing a representative that works at a law firm, you do not need to fill out this form. There's a different you can fill out this form, but you don't have to. You can also just get a letter on the law firm's letterhead. But you can use this form if your representative is somebody from a law firm. But if you want to represent a friend, a social worker, some other sort of advocate who does not work at a law firm, you're going to need to use this form to appoint them as your representative for your appeal. Just because you have a representative doesn't mean you can't go. You should still go to your own hearing. That's what we recommend, if you're able to, if that works for you. But they can be there with you and they can help speak on your behalf. Okay, so this is the appeals request form I was talking about, DOH 5231. We recommend that you fax it. Or if you don't have access to a fax, that you try to find a social worker or somebody who can help you fax it. The reason we recommend you fax this instead of calling, even though you'll see here that it tells you that you can make a request by calling, we recommend you fax it because whenever you fax a document, you will get confirmation that the fax was successfully sent. And we always recommend a paper trail. This is a new system. Some things are getting dropped, and we just want to make sure that you have a paper trail to show that you did, in fact, request an appeal, and it will show the day and the date, the date and time that you faxed it. So we recommend you fax it, and if you need help accessing a fax, we recommend you ask someone for help, and we recommend that you keep that proof showing that the fax went through. Same thing for appointing a representative. Even though this form says that you can do it by calling the call center, we recommend that you fax or that you get some help faxing. The fax number is the same. Please keep proof of the date and time that it was faxed. That way, if there's ever any question and you show up at the hearing and the hearing officer doesn't have any record of the representative, you can have proof that you did, in fact, appoint that person to be your representative. Rebecca will also put this link into the chat. We recommend you visit the NISO Appeals Decision Archive. This has, and actually it was just updated this morning, so there's an additional 300-something files in here. This has decisions issued by NISO hearing officers. Some are related to MECM. Some are related to other, MAGI Medicaid that's just on NISO. And some are related to qualified health plans and the essential plan. So it's not all relevant to MECM, but you can search for certain words here. And again, MECM decisions will only, the earliest that there will be an MECM decision is essentially December of 2025. So if you're looking back earlier than December 2025, those are not MECM decisions. And all of these have been redacted. But these are real decisions for real people's cases and appeals. Okay, now I'm going to just briefly talk through where to go for help. So if your client's case is in MECM, if their Medicaid or MSP case is in NISO or MECM, and it needs to be sent back to HRA, this is the correct email address to use, hxfacility@health.ny.gov. Please save that email address. If you're a social worker or a friend, you may need to get assigned HIPAA. You may need the client to sign a HIPAA, giving the DOH permission to speak with you. And if you have other questions about your client's case, or again, friend or family member's Medicaid or MSP case, you can contact somebody called an MECM assister. These are also called FEABDs. And I'm going to explain on this slide what an MECM assister is. So MECM assisters they each had to complete an online training issued by the state, and they're certified by the state. So they're trained. They're not just somebody sort of walking in off the street. These are trained professionals who can help with applications and renewals and other case actions, and they can help you troubleshoot problems and issues when they arise. Currently, MECM assisters are people who have already been trained as what's called an FEABD, which is Facilitated Enrollers for the Age-Blind Disabled. But in the future, and we don't know exactly when, the state is going to open up training to additional groups, including NISO navigators, NISO certified application counselors, and HICAP counselors. Please, please, please keep this page in mind. And Rebecca is going to put this page into the chat. This is how you find the list of MECM assisters. And when you find this list, and I'm going to actually put these instructions into the chat. Perfect. So you're going to go, you can click on the link that Rebecca sent. And if you do that, then you're going to hop to my instructions that I just posted. You're going to hop to number 3. Or if you forget that link and you just go onto New York State of Health and you're trying to find the assister, you're going to click on a button that says Live Help. It's on the top left of your screen. And that's sort of instruction 2 on the instructions I sent. And then under types of assistance, you're going to unclick where it says families and individuals under 65, and you're going to click where it says individuals 65 or older or those who are blind or disabled. If you do that, it will bring you to the screen that you see here. Unfortunately, there is no other way to just bring you directly to the MECM assisters. So please make sure to keep those instructions that I put into the chat, because if you make sure to unclick individuals under 65 and you make sure to click individuals 65 or older or those who are blind or disabled, you will see all of the MECM assisters, and these people are the best way to get help. We highly, highly recommend that you work with them. They are totally free. They are trained professionals and they are excellent. Also, we recommend that you read our New York Health Access article in MECM. Rebecca will put this into the chat as well. We have, I think at this point, it's actually maybe even closer to 12,000 views. A lot of people have been going to this page because the state has not yet published guidance on MECM. And so we are publishing just about everything we know about MECM. We're trying to keep this page up to date. So it's sort of text heavy. It is text heavy, and I apologize for that. But you can navigate. There's a little navigation page at the top, so you can click the different headers and read specific things you're interested in. You can also use the Control F or Command F feature to find certain things on the page if you have a question about renewals or a question about MECM assisters. But this is really the most up-to-date public-facing information that currently exists online about MECM. Okay, and with that, we're going to move to Q&A. So I'm going to stop sharing my slides. I know that Rebecca has been going through and answering a lot of questions already in the chat. But I will do a few more. So I see...
Rachel, let me ask you a couple of them just as I've been reviewing them.
Absolutely.
There have been a lot of questions and it might be worth reviewing on a high level what we understand about how cases tiptoe, you get to repeat what you said, a tiptoe into NISO and then into MECM, what that transition looks like. And just then again, I think reiterate coming to our July 9 training. So there were a bunch of questions about different issues people have seen or faced with cases moving from the district into MECM, as well as what do you do if you need to move back? So I think worthwhile to repeat those answers.
Great. Thanks, Rebecca. That's helpful. So tiptoeing, let's start there. So you can think about that slide that I had with the photo of the little kid's feet doing a tiptoe. So every single person who the state moves, again, this is happening behind the scenes. You're not opting in or opting out. The state is just doing it. If the state moves your case from the LDSS or HRA on to MECM because you qualify, you meet the criteria for whose cases can be in MECM, it does not go there directly. First, you're going to get a notice from your local Department of Social Services telling you sort of that it's happening. It's not a very clear notice, and we're going to talk through each of these notices in our July training, the second of the 2-part series. So first, you're going to get some sort of notice from your local Department of Social Services. Then you're going to get a NISO notice that has NISO identifiers, and that's just 1 month when your case is temporarily in NISO, the NISO door. So that's going to be the AC and HX identifiers. If you remember those red arrows that I had showing sort of those identifiers on the NISO notices, and that's just for 1 month. And then the state, and that's the tiptoe month, then the state is going to move your case into MECM, and that's where it's going to stay permanently, as long as you want it to be there and it qualifies to be there. And that's when you're going to get from then on out, you will get MECM notices that say NISO across the top, but they will have MECM identifiers. And those are the MC and PX identifiers. If you are in MECM and you want your case transferred back, the best way that we know how at this point and what the state has told us to do is to email HX facility. And that email address, I'm going to just put it into the chat. just so that everybody has access to it. This email address is hxfacility@health.ny.gov. That's the email address. If you, your client, or someone you know has a case in MECM, but their case needs to be sent back to the LDSS or HRA. Classic examples that somebody needs home care. They cannot get home care while they're in MECM, so their case needs to be transferred.
And just one more final question. There's been some really interesting inquiries about how someone could upload and renew online in MECM on their own. Do you have a few tips for how to do that?
Yeah, that's a really good question. Honestly, my biggest tip is if you are not already familiar with NISO, contact an MECM assister. I know that, some people are very savvy online and are comfortable using new websites, but there's really no harm contacting an MECM assister. They're entirely free. They can go through the website with you. They even get to, if you're having trouble logging in, they can help you create accounts. They can really walk you through each step of submitting that application. And so until NISO has public-facing videos talking through the MECM application, I think the best way to get support, if you need some support, is to contact one of those MECM assisters. Great. I know that there were more questions. We will take note of these and do our best to try to integrate some of these answers onto our article, our MECM article, which I'm going to just paste one more time. Please save this and come back to it. And I will just paste one more time our upcoming July 9 registration into the chat. Please make sure to register and please join us in our second part of this training series. Thank you so much for joining today. Thank you so much for participating in the polls, and we hope to see you in a few weeks on July 9th.